afternoon and good evening, colleagues and partners, and greetings from Singapore. My name is Lauren Sorkin, and I am the Executive Director for the Global Resilient Cities Network. We're very grateful to our co-hosts from the World Bank team, and we're very fortunate to have three very qualified presenters tonight who are going to speak to us about migrant and refugee-sensitive approaches to responding and recovering from COVID-19. And before I hand off the microphone to Francis from the World Bank to introduce our speakers, I want to remind everyone of the intention of the ground rules for the conversation today. The purpose of these global speaker series is to have open and honest learning conversations between practitioners in cities and governments and the partners who are supporting those entities. These calls are not on the record, and we ask that you attribute any comments made tonight to the speakers only if you have asked for their express permission to do so. We are thrilled at the response to this webinar, and we have over 500 people registered for this conversation globally. To facilitate the discussion as a matter of practicality, we ask that during the Q&A, you post your Q&A into that function in the chat. So you'll see it at the bottom of your screen and you can enter your questions there. So with that, I just want to say thank you for everyone for sharing your time with us this evening, and I will pass it over to Francis.
Thank you, Lauren. My name is Francis Guesquière. First, would like to welcome everyone on behalf of the World Bank City Resilience Program. Today's session, as Lauren already mentioned, will explore how cities have considered and are integrating migrants and refugee communities in their response and recovery planning. We'll have two speakers, Nora Preciado from the city of Los Angeles and Samer Saliba from the International Rescue Committee. I'm not going to say much about our speaker simply because we're very fortunate to have with us today Vittoria Zanuso, Executive Director at the Mayor's Migration Council, who will provide introductory remarks and present the two speakers. Victoria will speak for about 5 minutes, followed by Nora and Samir, who each will have been allotted about 15 minutes, which should keep ample time for the Q&A. Again, please ask your questions in the Q&A section of the WebEx so we can start grouping them and prioritize them for the Q&A session. Without further ado, Vittoria, the screen is yours.
Thank you, Francis. Thank you, Lauren. Thank you for having me here today. Today is a very symbolic and important day for me. I owe a lot to the 100 Resilient Cities Network, now the GRCN, where I grew personally and professionally for over 6 years. It seems yesterday that when the Syrian refugee crisis hit in 2015, we convened in Athens chief resilience officers from Athens, Amman, Los Angeles, Paris, and many of the cities that are with us today. And that was the first time in the field, one of the first times in the field, where people started to talk about urban migration as a resilience opportunity rather than a challenge, where everyone else was talking about it as a burden, a shock. And even today, with this new shock of COVID-19, I see the same mayors, the same city leaders countering toxic narratives spreading along with the virus and starting to frame migrants and refugees as a resilience asset, as the heroes that are providing food and healthcare to their neighbors, to their host communities in the midst of this global pandemic. Mayors don't do this only because it's the right thing to do, they also do it because it's the smart thing to do. As every resilience practitioner with us in this virtual room today knows by heart, social cohesion is really the secret ingredient of a city's ability to recover from known and unknown risks or resilience shocks. Mayors, so thank you for having me today with you and creating this space where we can really bridge the world of resilience with the world of migration. It's great to see that the Global Resilient Cities Network continues the work that we initiated at 100 Resilient Cities, and that you keep the focus on this very important issue. I am the Executive Director of the Mayor's Migration Council, as Francis said, and the Mayor's Migration Council is a nimble team of political advisors and experts led by a group of global mayors. This group spans from Los Angeles and Milan to Amman and Kampala and all in between. And when this COVID crisis hit, our mayors asked us to arm them and really arm the international community with practical tools and resources to make sure that global COVID responses are inclusive of migrants and refugees. We really quickly deployed our resources and our networks. We compiled a live resource guide, which we'll launch publicly today as an open source. And in parallel, we relentlessly and I would say successfully pushed philanthropies and international funds to unlock resources directly to cities. And most importantly, let cities and city governments be flexible in how they can use these resources. I'm sure many of you have seen recent announcements from the Open Societies Foundation and others on this effort. But still, cities have tight budgets, they have competing priorities, they are being asked to do more with less. So while our speakers today will be talking about how cities are responding to the particular and unique needs of migrant and refugee populations, we really want to ensure as resilience practitioners that these populations are not dealt with in silos and that every intervention to address their needs also benefits other vulnerable groups in the host community. This is really to prevent competition over scarce resources. This is to build social cohesion. And this is to unlock the resilience dividend that you're all very familiar with, I'm sure. That's also because when cities make their plans work for the most vulnerable, they also make them work for all residents. Take the case of Los Angeles, where Mayor Garcetti worked with the private sector and nonprofits to create a 20 million Angelino campaign for families in need of income who do not qualify for unemployment. This obviously includes undocumented immigrants, but also benefits informal workers and other vulnerable groups that might benefit from this intervention. And this is so important, especially in context of austerity, where resources are scarce and cities really need to be creative and resourceful. I'm delighted to have Nora Preciado, the Director of the Mayor's Office of Immigrant Affairs in Los Angeles, with us today. She will present on this campaign and other efforts that the city is taking to make sure that no one is left behind because of their immigration or refugee status. While cities in the US and in Europe are more in the response or even the recovery phase, we are also very acutely aware that COVID is having or could potentially have devastating impacts on low-income informal settlements in the global south, where the majority of refugees and migrants people live. Take the case of another city in our leadership board, Kampala in Uganda, where Lord Mayor Eric Garcetti is distributing food himself to vulnerable urban residents who cannot access key resources because of the lockdown measures. This effort is clearly supporting migrants and refugees, but is also supporting the vulnerable poor as a broader group. And is doing all of this despite bans from the national government. So following Nora to cover this important aspect of the story, we'll have Samer Saliba, lead urban advisor for the International Rescue Committee. He will be speaking to the impact of COVID on urban displaced populations, and he will be focusing on Nairobi and Maiduguri. I really look forward to these presentations and discussions. Nora, the floor is yours.
Thank you, Vittoria, and thank you, Global Resilient Cities Network, the Mayor's Migration Council, and the World Bank for the invitation to speak today. Very happy to be with you all this very early morning here in LA. The Office of Immigrant Affairs here in the city of LA is, our goal is to integrate immigrants in the city's social, economic, and civic fabric. And our work is usually done through coordinating city services, developing programs and initiatives that address their needs and that promote citizenship, civic engagement. And we also advocate at the local, state, and federal level. Our role has never been more important, I think, than now during this pandemic. And I'm going to share a little bit of the work that we're doing to address some of the unique needs of our immigrant and refugee communities during the pandemic. The county of LA is a pretty big population here in LA, in California. Our county is made up of 87 other cities aside from the city of LA, although we are the biggest city. We have over 10 million residents in the county, and about 3.6 million of them are foreign born. Half of them are US citizens, naturalized, and then about a quarter are lawful permanent residents and a quarter undocumented. Now, in terms of COVID cases here in the county, we have, as of yesterday, about 35,000 cases, 1,600 deaths, and about 318,000 tests that have been performed. So we're playing an important role here in the city in the response as the biggest city. We are seeing, like many of you around the world, the disproportionate impact that the COVID-19 pandemic is having on some populations. And by here, we're seeing that although we only have data dating back to April 26th, so it's a little bit stale, and only for about half of the cases that I just mentioned of COVID-19, we are seeing that it's having a disproportionate impact on Latino population, where of 10,699 cases, 46.4 of them, percent of them were Latino, compared to 23.7% white and others. Same with the rate of deaths. Of the 865 reported deaths where we have race and ethnicity, we see that 37.1% were Latinos who passed away as a result of COVID-19. And so because of this disproportionate impact, we've had to, by implication, a lot of those folks happen to be immigrants, since Latinos are the highest immigrant group here in LA. Because of that, we've had to really address or try to address the disproportionate impact of COVID-19. On May 1st, the mayor appointed Capri Maddox as our chief officer of the COVID-19 response equity. And basically, we just want to make sure that we're looking at every stage of our response through this lens of equity, whether it's testing, prevention, information about resources, and targeted outreach, with a lofty goal of a vision towards long-term addressing some of the root causes as to why we have those inequitable outcomes. That brings us to sort of the meat of the work that we've been trying to do. The mayor has been really proactive on having an inclusive action in response to COVID-19. And that is not only on the public health side, but also on the economic recovery side. As Vittoria was saying, it's important to ensure that all of the different programs and initiatives are really have this broader impact. While immigrants and refugees have specific needs, a lot of those things that we're doing to make accessibility easier to all of these responses really are going to benefit many other communities here in LA. So in terms of the public health response, we have been focused on testing and prevention. Testing is available to everyone, regardless of status, regardless of access to insurance or not. We've tried to make sure that there's locations in underserved communities, large Latino, African American, and immigrant population communities, ensuring that there's not just drive-up sites, but walk-up sites. That was a barrier as well. In terms of healthcare, just disseminating, the city does not run our healthcare system, the county does. And so while it's not under a jurisdiction, we really made sure to share information about what's available for all residents here, which is really important. And again, with the reminder that immigration status shouldn't be a barrier. On the economic impact of the response, there's twofold. There's what the city's been trying to do in terms of helping individuals and families. The mayor has created a number of initiatives that include just addressing the super basic needs of all Angelinos, but again, with an eye towards those that are facing really harsh financial fallout from this pandemic, low-income workers, low-income families, and again, by implication, a lot of them happen to be immigrant families. He issued things like moratoriums on residential evictions. Housing stability is a big issue in LA pre-pandemic. And so we wanted to make sure that we were addressing that now during this pandemic, preventing rent increases on some units, making sure that things as basic as not having your water and energy power and power turned off. Expanding again senior meals to those most vulnerable, and again thinking about accessibility not just to your typical seniors who live alone, but for example in a lot of immigrant communities seniors live in the household with others, but that doesn't mean that they don't need access to regular meals as well. And so there's been an expansion of that program. And then with the school district, a high percentage of our children in LA Unified School District depend on free lunch or breakfast programs. And so closing down the schools, one of the main issues we had to grapple with was how do we take care of all those children who depend on the schools for their food? And so there's 63 grab and go food centers where children can get 2 meals every day. And if parents come with them and also want to a meal, of course, they're provided one. For businesses and workers, that just really meant, again, the moratorium and evictions and making sure that we're providing this microloan program, business resiliency toolkit that sort of informs them of what's available at the federal, state, and local level to support them. And then also taking care of ensuring that all those workers, all those essential workers, which again, here in LA, the vast majority of them happen to be Latino, African American, and many of them immigrant. And so they are continuing to work and in a lot of ways exposing themselves to the virus to bring food to their families' tables. And so mandating things like face coverings be provided and refusing entry to people without face masks, filling in the gap in the federal program on sick leave to make sure that those people can also avail themselves of that, and setting up a job search portal. Vittoria, you were talking about some of the sort of specific strategies that different cities and here in the city of LA we've deployed to address some of the unique needs of populations that we don't necessarily focus as much on in terms of assessing the safety net gap. Here, it's been just what you mentioned, the industry capital of the world. We have a lot of independent contractors, self-employed individuals, but also a lot of individuals out of immigration status. In the city of LA alone, we have almost 400,000 of them. And so one innovative sort of private-public partnership has been the Mayor's Fund, the Angelino Fund, which created the Angelino Program. And it had 2 phases. One was basically the provision of grocery cards and then this cash assistance for those who were the most needy in the city, below the federal poverty level. And you can see the amount of money that we're talking about per family. It was a great success in terms of a fundraising effort, $20 million that are going to about 20,000 households to help over 60,000 Angelinos. The state of California followed suit and created their own program, which is going to get underway next week with $150 million for the entire state. So we're happy to have led the way here in California. We've also done a lot of advocacy at the federal and state level to, again, ensure that no one is left behind because of this inequity. We know that it's important to ensure that the federal and state authorities are also intervening, and that means asking the federal government that testing and treatment be inclusive of all, the financial assistance be inclusive of all. Unfortunately, the federal relief did not include a lot of immigrants. A lot of U.S. citizens who are married to undocumented immigrants are also left out, leaving a lot of mixed status families out of any financial relief. We're also doing some advocacy at the state level and with our county partners and the other 87 cities, just coordinating our work. Now, in terms of the recovery planning and inclusive future, we want to make sure that all the public health and economic measures that we are taking are led by public-private investment that address both equity, sustainability, and that have input from the community, all sectors of the community. And that really calls for a budget reassessment to consider, what's going to happen in the short term, but also in the long term as we face tremendous deficits. It's an understatement to say that our budget is going to be really tight and in trouble in the next couple of years at least. But we have to think about issues like housing and tenant support, access to healthcare, food security. All those issues were here pre-pandemic. They're exacerbated now, and we want to think about how do we address them long term and take this as an opportunity to do so. Other considerations, obviously, things as simple as we start to reopen very slowly here, we're starting to enter phase 2. Think about when you're opening beaches. We just opened the beaches back again yesterday for some exercise, active exercise. Those who live close to the beaches are going to be able to do that, and it's good for mental health. People have been in their homes for 2 months now. But what happens to those that don't live in wealthy communities near beaches? What mental health outlets do they have? We need to think about things as simple as that. And continue to just evaluate the accessibility of all the programs and initiatives that we're putting forward beyond the pandemic. Another thing we've really focused on has been workers' rights issues. As I mentioned before, the fact that most essential workers here in LA happen to be people of color is bringing a lot of issues to the forefront. And we're working, for example, in the garment worker industry. They're producing PPE. How do we support them through this? How do we address some of the concerns and those that, again, pre-pandemic existed? How do we take advantage of this moment to address them? And then obviously we've all seen the data lately about when we all shut down, our planet was a little bit happier in terms of climate change and sustainability issues. So we want to ensure that we are thinking about a green future. The mayor has been a leading force nationally, internationally, and he will continue to do that as we go through the recovery and planning phase. Just a couple of recommendations since I know that it might be useful to other cities as we're thinking about it. And again, this is something that we're thinking about here too and figuring out as we go along in this unprecedented time. Just ensuring, I think, that all recovery measures are as broad reaching as possible. Again, going back to Vittoria's point, if it's helping immigrants, it's probably helping a lot of other underserved communities here in LA. And so while we want to keep a focus on specifically my office on underserved communities, like immigrant communities, there are many others that could benefit when you make things so accessible and easy to reach and easy to learn about. And we will continue to evaluate the access to programs and initiatives by asking, is language accessible, location accessible, regardless of immigration status? Is there an access to technology barrier? Are you requiring too much proof of identification or documentation? And again, just making sure that our strategy for getting the word out is really robust with key messages that, again, are language accessible to all our communities. We have 12 top languages here in LA, so we have to make sure that we are thinking about that. And then in terms of, I apologize for that. In terms of communicating and collaboration with all stakeholders, it's an opportunity to maximize on existing partnerships and create new ones. And so we, again, are learning from a lot of our sister cities around the world and look forward to continued conversations about how we can come out of this pandemic stronger, more unified, and definitely making those that have been more vulnerable more stable than before. With that, I will turn it back to Samer so he can share with us his thoughts.
Great. Thank you, Nora. Pleasure to be here. Thank you so much for having me. Give me a second as I deal with my myriad screens that are in front of me to make sure that presentation is up. Tori, can I get a thumbs up from you if you can see this okay? Okay, thank you. So again, thank you for having me, and thank you to the Mayor's Migration Council, the World Bank, the Global Resilient Cities Network for organizing, and especially to all the city representatives on this call for the work that you're doing to protect your residents, especially the most vulnerable among them. Thank you especially to Nora for all the work that you're doing for migrant and refugee Latinos within LA. As mentioned, I'm Sam Saliba, the Urban Advisor at the International Rescue Committee, where we work in over 40 countries serving people whose lives have been affected by crisis to help them survive, recover, and regain control of their lives. Unfortunately, with COVID-19, we know that there's been a global increase in the number of people whose lives have been affected by the crisis. And the IRC estimates that we could see over 1 billion cases of COVID-19 and 3.2 million deaths in the country where the IRC works if we don't act now and act prudently. These preliminary estimates compiled by the IRC are based on epidemiological modeling and data produced by the Imperial College of London and the World Health Organization. And based on this data, for the first 6 months of our global COVID response, the IRC's priorities include first, keeping our staff and our clients safe, building from evidence and quality standards, adapting to fast evolving needs using technology and other remote approaches, ensuring that gender equality is integrated throughout all aspects of our response, and in my opinion, perhaps most importantly, supporting local and national response efforts, specifically city response plans, because, as we all know, cities are on the front line of this crisis. But if cities are on the front line, that means that displaced people, internally displaced, and refugees are also on the front line. This is because, as most of you I'm sure know, the majority of displaced people live not in camps, but in towns and cities around the world. And as you can see on this slide, it is predominantly cities on the right side of the globe, or the right side of the slide, where the majority of displaced reside. This data is from 2018. For those of you who have heard me speak before, you'll know that I can't take a speaking request without mentioning that the cities hosting the most displaced resources are doing so with the fewest resources. Sorry, the cities hosting the most displaced residents are doing so with the fewest resources. And while we often hear about the fantastic efforts of cities like Los Angeles and the work that Nora and her team are doing to support Angelino migrants and refugees, we as an international community need to do more to support city governments and communities hosting the majority of the world's displaced. As with most issues of social inequity, COVID isn't creating this need, but it is shining the brightest spotlight on it. So let's take a little bit of a world tour. In Nairobi, a city where the IRC has a long-standing presence of supporting refugees and vulnerable Kenyans, I'm going to talk specifically about the livelihoods of these populations, the majority of whom reside in Nairobi's low-income informal settlements, such as Kibera, that you see pictured here, and you see one of those livelihoods that is likely threatened by COVID-19. So according to recent data collected by our IRC Kenya team, who heard from over 1,000 IRC clients, both Kenyans and refugees residing within Nairobi and the surrounding counties, almost half reported being a victim of COVID-19 in some way. While not the case of all of our clients, again, the majority live and work in low-income informal settlements such as Eastleigh or Kibera. And our programming in Nairobi is predominantly livelihood support, so that has colored the responses somewhat. But nonetheless, for this sample, the majority of clients who have been affected by COVID-19 have lost their source of income and or have been forced to close their business, while a smaller number of people, thankfully, have been psychosocially affected, quarantined, or hospitalized. At the same time, the prevention measures that they're taking are limited to the basics of COVID-19 prevention, which we all know, such as hand washing or avoiding physical contact. But perhaps most importantly, this combination of factors affecting our clients is causing them to prioritize food as the primary need, with rent coming second. And for those of you familiar with Nairobi and other cities similar to Nairobi, You'll know that rent tends to be number one pre-COVID, but now given the loss of income, it's food. So whereas rent was first and food was second, now we're seeing food first and rent second. Loss of income is especially a problem for refugees because in addition to the barriers faced by all residents of low-income informal settlements, refugees have additional barriers related to their migration status, their right to work, and discrimination affecting their ability to start a business, either because they can't find Kenyans willing to serve as their guarantor, or they fear retaliation if they do happen to succeed establishing a business, as we've heard from some of our clients. And the quote you see from one of our Kenyan clients sort of talks about how she wanted to be a guarantor for a Congolese business, but couldn't find other Kenyans willing to support. I think there is where social cohesion really comes into play, as Vittoria mentioned at the beginning. So what can we do about it? First and foremost, we can maintain communication with our clients to monitor their livelihoods needs, as well as other needs. This helps us make sure that we don't lose the progress that they've made, as well as helps us identify areas of need where we can turn our focus and when we can turn our focus to recovery. We've also heard that this communication is really helpful just from a mental health standpoint, letting them know that we're here for them and that other providers are here for them. We also leverage these communication channels to share health and hygiene information, which is why you saw so many people reporting that they're washing their hands. And we rely on referral channels with other organizations, especially as it relates to cash assistance, given that food is the #1 priority. That said, cash assistance programs in Nairobi, and I'm sure in other cities, as you can imagine, are stretched to capacity. So while cash is a top priority right now, there isn't enough funding to meet this need, and we're trying to bridge this gap by providing remote business support, advising our clients on how they might pivot their business models to continue operation, but in a safe manner that adheres to local guidelines. An example of this might be a coffee production company where they really rely on brick and mortar model, but they're now pivoting to a coffee delivery business model to maintain that livelihood. All the while, we can't lose ground on the progress we've made, and we're preparing for a much more robust and systematic livelihood support in direct partnership with East African cities when they turn to the recovery phase, because we know exactly how badly they'll be needed. Before we move on from Nairobi, I'd be remiss if I didn't mention some of the amazing work that grassroots organizations like Shack and Slum Dwellers International is doing in the city. Literally just an hour ago, I learned about their quote, coronavirus situation tracker for Kenyan informal settlements, which has so much useful information, such as that only 11% of Nairobi's settlements, informal settlements, are reporting the availability of testing on average. So I encourage you to look that up. So we can't travel in real life, but I'd like to virtually fly you to West Africa and land us safely in the city of Maiduguri, which is the capital of Nigeria's Borno state. Due to violence in northeast Nigeria, the city has seen an estimated doubling of its population over the past decade or so, while still having to contest with militant insurgencies and a general lack of resources. The humanitarian response to internally displaced living with Maiduguri up until recently has been just that, focused on emergency response. But with the situation lasting as long as it has, the IRC and our partners in ACTED and Impact proposed a different kind of humanitarian intervention, one that focuses on building local resilience of the most vulnerable communities, including displaced, rather than continuing on with an emergency response mindset. The ECHO-funded 3-year project titled From Response to Resilience, which is a name I'm rather proud of, so please don't steal it, focused on 3 high-risk neighborhoods and takes a community-led, area-based approach to identifying risks, developing neighborhood resilience plans, and directly funding projects in those plans related to disaster risk reduction based on community prioritization. We do this while also working with state and city actors to build their capacity around disaster risk reduction and response. But for the purposes of this presentation, I'm going to focus on our community-facing efforts. So some more data for you. Continuing with the trend of cities on the front line, I have so much data on these slides that I had to meet that challenge. We were just a year or under a year from response to resilience in Maiduguri when the city saw its first case of COVID-19, just I think over a month ago, or a little under a month ago. And it turns out it's a great time to be working on an urban resilience project before a crisis hits a city, because most of the data that you see on this slide was collected prior to COVID reaching Maiduguri, and Acted on our team was able to leverage the communication channels with traditional leaders to complement that data with COVID specific data post COVID. So the map on the left shows the 3 neighborhoods where we're working, overlain with relevance values that are based on 2 things. First, proximity to IDP locations, and second, geospatial information related to the 2018 cholera outbreak in Maiduguri. So based on these relevance scores, we know 2 things: that our 3 target areas are both home to a lot of displaced residents, and that these neighborhoods are already at a high risk of infectious diseases. This city data is complemented by a 1,138 household survey in our 3 target neighborhoods pre-COVID, and a survey of 170 traditional leaders, or bulamas, post-COVID. This data is shown on the right-hand side of the slide, where you can see that not only do residents of these neighborhoods live with 9 other people per household, so think about social distancing there, but the vast majority do not have sufficient access to water, which of course is the main ingredient in Maiduguri's #1 response to COVID, hand washing. At the same time, similar to Nairobi, the majority of residents in these neighborhoods rely on informal daily wages and use those wages primarily to purchase food. So we see some trends emerging between Nairobi and Maiduguri. Needless to say, this data paints a bleak picture, but the good news, again, is that we already had a process in place to not only better understand these risks, but to also empower communities to do something about them. So what is that something? First, through response to resilience, we're leveraging existing community channels to share life-saving information related to health and hygiene. But more importantly than the information is that the community trusts this information because we have spent time pre-crisis acting to build that trust. Second, we know that while all residents of these neighborhoods are underserved, IDPs and other vulnerable residents, especially people living with disabilities, are not receiving the support they deserve. There's an assumption in Maiduguri, which has both urban IDPs and camp-based IDPs, and I would say that this assumption is very common in most displacement contexts, that the displaced living in cities chose to live in cities, and so therefore are well off, while those residing in camps are in more need of assistance. So while there's not a lot of resources in general, the resources that do exist are directed to those camps. But I hope that the data on the previous slide shows that that's simply not true, and there are very significant needs within urban areas and for urban displaced as well. Third, we're starting efforts to document and learn from our failures in the Maiduguri response to COVID-19, especially for the most vulnerable. We already knew about the limited access to water and health facilities these communities face, but now we know exactly how important they are and can prioritize resources as such. And lastly, we're starting the recovery in the response. And actually, in the case of this project, I would say that we started the recovery before the response. And that is precisely because we made the conscious decision as a humanitarian organization to take a resilience approach to an urban displacement crisis. We did this by designing a project based on what the IRC terms inclusive city planning. Inclusive city planning is an intervention that ensures that city plans, policies, and projects are designed with the input of displaced and marginalized populations and inclusive of their needs and preferences. Simply stated, inclusive city planning is a process that values displaced community voices as much as it does analytical data, technical expertise, local capacities, and that this data is used in both the city-led and community-owned process, and the results are inclusive resilient city plans and projects like we will have, thankfully, for the 3 neighborhoods of Maiduguri. And it's precisely because we should be valuing those voices. Our fantastic community outreach officers in Maiduguri, some of whom I hope are listening on this call, helped me with this presentation and reached out to some of our, I'll call them local resilience planners, but they're really community residents, and asked them what they would like this international audience of 300 plus people to know about their lives. And this is one of their responses. And I think it's so important that I'm just going to give 10-second pause so that people can read it. Great. Thank you for listening to one of our clients. So for those of you who hear the Maiduguri story and say that it's too late to think about preparedness or too early to think about the response, please keep in mind that the cities where the majority of refugees and displaced reside are still early on in their fight against COVID-19. And going back to how I started this presentation, there's a real risk of not thinking about how we as an international community, including city representatives, can best serve displaced and marginalized communities, and how we can work with these communities so that they can better serve themselves. From the IRC's perspective, we must take 5 specific steps to protect urban displaced, one of the most vulnerable groups in the fight against COVID-19 now and in the future. First, we need to ensure that local city response and recovery plans work for urban displaced, recognizing that a plan that works for them will work for the whole of society, as Nora and Vittoria have already mentioned. 2, we need to support local efforts to strengthen social cohesion as an effective public health intervention. There are examples from city responses around the world that show that first responders are not police or healthcare workers, but neighbors. And this has a tremendous effect for the type of neighborhoods where we're working. Third, we need to respond to emergency food security needs now while planning to improve livelihoods and work opportunities in the future. Fourth, we need to ensure equal access to information and essential services. And I really liked how Nora put this point, because it's not always about creating new services. Sometimes it's about looking at your current services and making sure that there are no barriers that specific vulnerable populations face in accessing them. Language barriers, barriers related to migration status or documentation requirements. That is a very low cost intervention that can help a lot of refugees and migrants if you're just making sure that they have access to the existing response efforts that are there. And lastly, and perhaps most importantly, we need to engage urban displaced communities as COVID-19 response partners. Engaging them builds trust needed to ensure their buy-in and ensures that response efforts are adapted to the local context and owned by the communities they aim to serve. There are countless examples of displaced communities and refugee-led organizations responding to their communities, such as I want to give a shout out to Yared in Kampala, who is taking the lead in distributing food to their vulnerable refugee communities in their city. And it's these efforts that we need to lift up, because while cities are on the front line, at-risk communities are first responders. So I attended last week's Cities on the Frontline webinar on recovery, and I was very happy to see that 79% of the community in practice saw, quote, enhanced social equity as the most critical factor of COVID-19 recovery. Kudos to all of you. So if you're a city representative and you're in the middle of developing your COVID-19 recovery plan, I challenge you to think not only about how that plan includes displaced and marginalized residents, but also what role can they play in leading their own response and deciding their own futures. With that, I thank you and happy to take your questions.
Thank you, Vittoria. Thank you, Samir. Thank you, Nora. We have about 15 minutes for Q&A. And before that, I want to reassure everybody that we always have the question, will the presentation be available? All the presentations are recorded and the recording is available online following the same link that was used to register. Quite a few questions. And there are actually a couple of questions that could be bundled together. We had a presentation, Nora and Samir, a couple of weeks ago on Singapore, which has observed an explosion in the number of cases among migrant workers. But surprisingly, the mortality rate has been extremely low. And this is mostly because migrant workers in Singapore are mostly young and fairly strong. They come for the construction industry, which shows that demographic has a huge impact on the impact of the disease. Have you observed among your, I mean, first in Los Angeles, but also among your client countries, Samer, differences or striking differences among different groups, different communities? And have you been adapting your program accordingly? Maybe we'll start with Nora in Los Angeles and then go to Samer.
So I mentioned that a lot of the essential workers here in the city do happen to be people of color, and by implication, many of them happen to be immigrants. We haven't, I'm not sure that we have data specifically of like essential workers and whether the death rates are different. We do know that a lot of them, and this is why the mayor took some action in terms of providing or extending, filling in the gaps of the ability of those workers to take sick leave, for example, because a lot of it is sort of they're being put in the difficult choice of, even if they are vulnerable, continuing to work because they need to financially, right? Not necessarily that they have the freedom to do so, to make that choice without paying those consequences. And so we're trying to think about how do we, for those who will continue on the front lines, at the grocery stores, healthcare workers, all of those, how do we protect them? And so some of the orders that he's been mandating in the last couple of weeks, a few weeks, is for any of those essential businesses, right? The increased hygiene, public health sort of safety measures to make sure that they're protected. Things as simple as our transportation system must continue to run, those essential services must continue to happen, because a lot of those low-income workers, a lot of those immigrants depend on buses to be able to get to those essential jobs. But things as simple as, how do you protect that bus driver? You ask people to board from the back. You ask people to now, starting just recently, everyone who is outside their home must be wearing a face mask. So it's both sort of really practical, simple, common sense approach, but also on the worker side, how do we allow them the true freedom to choose whether they have to step out of their homes and go provide those services and take on those jobs during this time. And there may be some that, you know, because of their vulnerabilities, that just doesn't make sense, but they must have that choice and that financial support to be able to do that. So we're trying to act on both fronts.
Yeah, maybe from my side, I'll say that again, it's still very early, thankfully, in the countries where the IRC works, where we haven't seen the amount of cases that other countries have seen. So that's a good thing. But I think it's been interesting to see the reaction over time to some of these cities where there's an initial shock reaction of complete shutdown. We see what works and what doesn't work from that shutdown. And then some creativity starts to bubble to the top about the nuance that's really required, especially in some of these low-income informal settlements. So in Maiduguri, they did resort to a lockdown, but they had 2 days per week, and I think they still have 2 days per week, where the lockdown is lifted. So you can imagine what happens in those 2 days, right? There's actually the worst social distancing you will ever see in any city, because everybody's trying to get their shopping in or make whatever buck they can within those 2 days. So now what we're doing is trying to collect as much information from the communities we're working with. And thankfully, we also have connections to Borno State and the Metropolitan Council, and trying to facilitate some communication there about what's working and what's not working, and see how we can be more creative and more nuanced and rely more on the voices of the people who we're trying to serve as we move forward.
Thank you for those answers. I'm going to pose a little bit more of a technical question. As we know, this is a group of practitioners, and Your comments, Nora and Samer, have piqued some of their interest, as well as from you, Victoria, when you talked about tools and methodologies. I think what the participants would like to hear more about is what are the practical tools and approaches you can use, in particular, those that might help you with communication and getting the right information out, as well as those that were mapping or giving that situational analysis. There was a specific call out, Summer, to the situation tracker for the informal settlement. So what, in your view, are some of the best tools for getting your plans right, getting your communications right, and really assessing the situation? And likewise, what are some of the policy tools that could be used as you're setting your best foot forward for recovery and protecting these sensitive groups?
So I'll start and I'll touch on both of those briefly. On the outreach, we have tried to, and this has been work that we started before the pandemic, focus in on making sure that all the resources, available information, going back to a point I had made earlier, is the communities that are targeted by those programs actually know that they exist. And that's become a bit of a bigger challenge during the emergency crisis situation, because everything is moving so quickly and the needs are arising so quickly. And so just ensuring that that we were, one, eliminating language barriers. The mayor has been great. Every night for a number of weeks, he was doing a daily briefing, and he was doing part of it in Spanish, again, because the majority of our migrants here happen to be Latinos, Spanish speaking. But even simple things like at the beginning of the pandemic, he has the coronavirus webpage that I shared at the end of my presentation, where all the information about all city programs, orders, everything, resources is captured there. We were translating that into Spanish every night. And that just became overwhelming. And so we decided to just put a Google Translate widget on it so that we could at least provide information as quickly as it was becoming available. And we've actually been in communication with Google to refine the translating capabilities that they have. We use a lot of terms of art, a lot of specific terms, and we actually had a conversation about how those were not being translated accurately. They've been fixed. So just things as easy as that. And then obviously partnering with ethnic media. Samer was talking about trusted messengers. We've done a lot of work since 2013 when this office was reopened to ensure that we are keeping sort of relationships with those communities and are seen as trusted messengers. But there are also others in the community that are trusted messengers just because they work in the communities and have been there. And so relying on them to also disseminate accurate and timely information coming from the city about all the city programs and initiatives that we're thinking about.
So while Mayor Garcetti is doing a fantastic job giving daily briefings, and the translation that's happening, I think I like the creativity, Nora, about just like tapping on a Google Translate widget and getting it done. I think the more, sometimes the least fancy solution is the most effective. In some of the northern refugee settlements in Uganda, our staff have put a speaker on the back of a boda boda, which is a motorcycle, and started driving around with that speaker playing key messages in languages, in the myriad languages that are spoken in these refugee settlements. And it's quite a thing to see, actually. I don't know if I can share a picture, but you know, you have a little motorbike with this whole speaker attached to it on the back and you're driving around. I think the most important tool is not a use of technology or, you know, or some other like silver bullet. The most effective tool, I would say, is context analysis. And being able to ask people what is your preferred way of getting information. In Maiduguri, we know about the Bulamas, the traditional leaders. We know about the use of radio. And it's these sort of, you know, by just having that simple conversation and understanding context in as best you can, you realize that there are very simple solutions to very complex problems. And I think that's a good thing, not a bad thing. Lauren, you mentioned so the let me get the name of it specifically. The situation tracker of low-income informal settlements. I want to be clear, that is not an IRC document. It's a document of, if I didn't work for the IRC, I would be knocking on these people's doors. The Shack and Slum Dwellers International, which is a grassroots organization, and it's their hard work of collecting data in several informal settlements in Nairobi and other counties from May 10th. So it's relatively recent. But if you Google situation tracker informal settlements, you may be able to find it, but I can also find the link as well.
Nora and Samir, we have just a few more minutes, but I don't know if you have, one of the questions is, have you observed reverse migration, and does that bring particular issues that city managers should be aware of and give any advice? But really quickly, we only have a few minutes, maybe starting with you, Nora, again.
We have not, as a result of COVID-19, there had been a trend, but that was caused probably by just the federal immigration and refugee related policies of the last few years. We have seen a decrease, one, in migration, and two, an increase in people going back to their country, particularly Mexico, that used to be the biggest sending country to the United States, particularly to California. But we haven't seen that as a result of COVID-19, not yet.
Yeah, I mean, there's been a lot of global data on reverse migration. I think here it's really important to understand the difference between displacement and migration. Migrants have the choice to go back home, refugees and displaced do not. So we're not seeing that.
Again, the unfortunate duty falls to me to start to bring us to a close, because this has been an incredible conversation, and I think one that we could continue and facilitate more dialogue on. To that end, we will make, as Francis said, the presentation available, including additional pictures, materials that Nora or Sam or Vittoria, you want to provide for us that help us to share these good practices and these context-specific practices that may resonate with members of the community. So we're very happy to do that. Also, in the spirit of continuing the conversation and keeping this safe space to share, we will be back here again next week. And next week's speaker series will focus on the pandemic resilient city and how we can start to think about managing risk as we continue through this crisis and starting to open up what can be expected in a 3-month horizon and what might be realistic measures to take over the next several years to really manage this risk more comprehensively as we recover. And we'll have a guest speaker from India, from one of our cities in Pune, and also someone from Risk Management Solutions joining us. So I hope that you'll come back and spend the time with us. I want to give a huge thanks to our speakers this evening, to Nora Preciado from the city of Los Angeles, to Samer Saliba from IRC, and in particular to my former colleague, friend, and wonderful executive director of the Mayor Migration Council, Vittoria Zanuso. Thank you all so much for being here tonight. And thanks to everyone who's called in. Take very good care, and hopefully we'll hear and see you next week.